The content herein is for informational purposes only, not intended as medical advice, diagnosis or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Greetings and welcome to our LymphCast show. Believe it or not, episode 55 tonight. We're glad that you are with us. A reminder to visit our website early and often. That's lymphcastnetwork.com. Everything is there for you about the show and information. If you have a question for one of the doctors on the panel, you can always email that, hello@lymphcastnetwork.com. Every show is on podcast land. Wherever you go for your podcast, just type it in, you'll find us. And every show is on YouTube if you prefer to watch and listen at the same time. Well, let's go ahead and meet our panel. We'll kick into gear right away tonight. Regular panelist from California, Dr. Emily Eicher. Hello, Dr. Eicher. How are you tonight?
Hello, wonderful team. And hello, Patty. Cornuto, we are honored to have you and share your experience with us.
All right, very good. The gentleman who started this show, he's also the owner, founder of VitaSupport MD. They make Vein Formula 1000 and Lymphatic Formula 1000. Physician surgeon from New Jersey, Dr. John A. Chuback. Hello, Dr. Chuback. How are you?
I'm fine, Paul. Thank you. Good to see you. I'm looking forward to a great program tonight.
Absolutely. It's going to be terrific. And Dr. Chuback, why don't I just kick it right back to you? You bring our guest in and away we go.
Sure. I am going to introduce tonight's guest, Patty Cornuto. I've known Patty through social media and through LinkedIn, particularly indirectly for some time now. We've been kind of following each other and admiring the work that one another is doing. Patty is a well-known patient advocate, and she is the founder of Lipedema Fitness. And as I understand it, that began as a blog and a Facebook support group for other people with lipedema like herself. And she's been working really, really hard at that. And her goal is to reach others and raise awareness and help others to feel that they're not alone on their journey. And my understanding is that it's her 10th year anniversary last year, showing that she was really very much ahead of the curve and ahead of many of us who've gained interest in this important area. And she's about 14,000 members strong there. So there's so much to talk about with Patty, and I know she has a lot to share. I could go on and on with her introduction, but with that, I'm going to welcome Patty Cornuto to the program tonight. Patty, thanks so much for being with us.
Oh, thank you so much for having me. It's such an honor to be here.
Yeah. Is there anything that I left? I know that there's certainly, you have many more accolades, achievements, and interests, but before we move on, is there anything else in your background that I didn't touch on that you want to make sure everybody knows about?
No, I think you covered it well.
Okay, terrific. Well, I know that from an email that you sent, which was a very, very emotional and not in a heartbreaking or negative way, but emotional in terms of passion and excitement and enthusiasm for what you're doing and what we're doing here at the LymphCast. But I know that you mentioned in that you're a big fan of Dr. Emily Eicher, who has committed her career and devoted her professional life to this very important subject, and especially what she's doing in looking out for young people, and particularly young women with this problem. So with that, I think it would be nice to start the program by giving Dr. Eicher an opportunity to say hello and ask our first question. Emily?
Thank you. And again, it's a great honor to see you, Patty, and share your expertise with us. Tell us, how did you start? When did you find out that you have lipedema?
I had my daughter in 2004 by a C-section, and a nurse in the recovery room mentioned my legs and asked me about cellulitis, and I didn't know what she was talking about. And I had noticed my leg shape just went drastically into a traditional cuffing and column shape almost overnight at the hospital. And from there, I started trying to research and ask my doctor what was going on with my legs. And she ran all kinds of tests that you can imagine. Typical women with that kind of symptoms might have a DVT or other complications from the pregnancy or the surgery. And I would go through all these tests and everyone would just come back fine. And she would kind of try to send me on my way. And I just started Googling, and it took me 3 years. I found a patient blog and just printed out everything. Every link she linked to, every contact she talked about. And I found a VODR trained therapist near to my town and went there. And in 2007 was diagnosed with late stage 3 lipedema with secondary lymphedema. So I have lipolymphedema.
Unfortunately, rather typical onset or diagnostic evaluation that I see with most of my patients. But then you took it into your hands, and I see now you are not only founder of Lipedema Fitness, but you are participating. So take us through the journey of being diagnosed and what happened then.
Absolutely. In 2007, when I was diagnosed, we were also being told that diet and exercise wouldn't work and it would possibly make our condition worse. And we listened. We were so fearful of making the condition worse. And I had just seen a drastic transition in my legs happen. So I didn't want that. I did everything else they told me. I elevated my legs. I went through decongestive therapy treatments with a CLT. I got bandaged for 2 or 3 months, had been fitted for compression. And then I just kind of stayed inside. I wasn't supposed to be in the heat. I kept my legs elevated as much as possible. And I even went down a path of like learning Reiki to try to find another way of combating, because I was a very active person. So for me, right before I went into the hospital to have my daughter, I was at the gym the night before. So for me, it was a big, huge shift. And I progressively got worse. And finally, I said, this is crazy. I'm not going to keep listening to this information. And my husband was a CrossFit instructor. And I said, what's the workout of the day? And he's like, why do you want to know? And I said, because I am so far advanced in this short time of listening to the advice we were being given that I now was almost entirely immobile. And I said, if I fall down, I want to be able to get back up again. And he said, we can do that. And we started training right then and there in very modified CrossFit, which is really about body weight training, push-ups and sit-ups and squats and things like that to get my core strong enough that I could eventually get onto the floor to be able to train, to be able to get off of the floor. And right then I was like in the groups. In 2007, there were no Facebook groups. There was no Facebook. So it was really not that type of situation. But right around 2012, I think it was, the group started happening. And I would be in the group kind of sharing what I was doing with my husband. And nobody wanted to hear me talking about fitness because we were all so, trained to not do that. And I was being like, well, who are you to tell us this is what we should be doing? And I just felt like I was maybe annoying people. And I talked to a few of the people who ran the group. And I said, what do you think if I start a fitness group? And they said, I think it's a fantastic idea. And it did start with a blog. I wanted to pay it forward like the blog I had read. And I turned a letter I had tried to write to my local paper into my first post on July 4th of 2013, Independence Day. And I just said, I'm not going to have them tell me I can't voice this. I'm going to voice it myself. And it began there. And then I started the group. And in 2019, I joined up with Juzo and I became a brand ambassador for them and attended a nice conference, their Power Symposium conference. And then I had a bunch of medical professionals looking for information and trying to join my group, but it's very very private for people with, patients. So I started Instagram and LinkedIn and other more public platforms so that I could help spread awareness to both sides of the community.
Well, first of all, congratulations. And I think that we have to emphasize what you are doing with the fitness and lipedema, linked to lipedema and lymphedema, even more so. in one of my lectures, and you probably know I am very keen on lipedema in children, because the earlier we diagnose, the less advanced lipedema we are going to see. And I did demonstrate on a 15-year-old girl, lipedema stage 1, that her subcutaneous tissue improved by 41% in reduction after 3 months of cross-country training.
Wonderful.
So all the old stories about lipedema and just being in the bed and keeping the legs elevated are not applicable. And I do see a lot of lipedema patients on a daily basis. And I do want to point out that once we are stage 1, we may continue being stage 1 with some improvement till the rest of our days. The other day I had a patient and she said, oh my gosh, I'm so worried that I'm going to be with stage 3 a decade from now because lipedema is progressive and so on disease. Not true. And I just came back from fantastic conference at the Istanbul European Group of Lymphology, European Society of Lymphology, where there was a lot of genetic study on lipedema. And once we are diagnosed with lipedema, we cannot be very passive. And congratulations to you that you took it into your hands and you are demonstrating that indeed you can improve, and you can improve your quality of life, and as well as volume reduction, and all the symptoms may improve. You may not eliminate the DNA that was given to you because of lipedema. However, you don't have to be stuck with stage 3 and then progress to ++. So congratulations, and tell us a little bit more about your fitness center.
So my husband is still training me, and we have a bunch of other members of his karate group that train with us. And we share our videos every week on Instagram. We field questions from our members, and like we've shown them a series of videos of how to get down safely on the floor and how to get back up off the floor. When you have lipedema, it's very painful to kneel. So having options of how to get down and get up safely are things that we kind of focus on. And we work with people to understand that taking the action of moving in ways that feel good to them are the most important thing for them to do, so that they continue to do that. And by taking the action and being physical and moving their bodies, it helps so much emotionally. Like, you don't feel like the victim of this condition. You're taking action, you're able to do something and kind of fight back.
Emily, I have a question for you, a couple of questions for you. Such an interesting discussion. Number one, do you have any idea where that old paradigm of thinking began, that lipedema patients should not exercise or could be doing harm to themselves through exercise?
Well, I think in the past, I would say past 20 years, we didn't know much about lipedema and diagnosis of lipedema. And way back when there was only VADA training, and VADA was not a physician. So it was just kind of, you will improve with manual lymph drainage stimulation. But we didn't have any scientific background. We didn't have any studies on lipedema and behavior of lipedema. Today, we are much more knowledgeable. We know that there is great hormonal influence and so on. And instead of sitting and resting and feeling a victim of this annoying disease, we can participate just like Pat is doing, and improving quality of life. So I think it started way back when. Who started? I don't know really who coined that, don't move too much because you are going to progress in swelling, because we didn't have enough medical scientific background on lipedema.
Agreed. And it's just one of the things that our listeners have to understand, that physicians and the scientific community, just like anybody else, learn as they go along. And unfortunately, as we look back at the history of medicine, we see a lot of wives' tales and folklore and things like this that we now look back at and sort of shake our heads. How could it ever have been so? For example, even I can remember as a surgical resident, back then, it was a paradigm shift for people with venous disease to be mobilized after vein stripping and so forth. Initially, it was considered bed rest because to decrease the chance of bleeding and so on and so forth. And then, of course, we had many more DVTs than we should have, pulmonary embolism and so forth. And now all of that kind of work, or nearly all of it, is being done in an ambulatory setting without general anesthesia, without sedation. Most of us who are, contemporary experts are doing these things under local anesthesia or when possible with no anesthesia to keep people moving. So we're learning as we go. The other question I have for you, Emily and Patty, you please feel free to jump in, because I believe both of you were at the FDRS meeting this year, the Fat Diseases Research Society, and Emily just came back from Istanbul. Emily, do we know specifically why people with lipedema are hypersensitive and have the associated tenderness and sensitivity on palpation? Patty mentioned how difficult and painful it can be to get in a kneeling position.
Well, when you look at the most of the physical distribution, it is enlargement of the subcutaneous tissue waist down. In some cases, you may have involvement of upper extremity as well as the truncal involvement, but predominantly around the knee, you have sometimes folds, or in the medial aspect of the knees, you have enlargement. It's usually very painful to touch. And so why is it painful? I don't think we really know specifically. However, I just presented on Dercum's disease, and Dercum's disease is usually the patients are with lipedema, with adipose nodularity under the skin in superficial or deep layer of the subcutaneous space. Do we know if the pain is just the Dercum's, or do we know if the pain is contributed from the fascia? I think there are both components, and we need to do much more research on the fascia involvement in lipedema as well as in other Dercum's disease, as well as the adipose tissue. Some of the adipose tissue in early phases of lipedema are small, just like small pearls to palpation, or a rice type subcutaneous uneven tissue. But when you have stage 3, you may have small little ping pong balls there, and they are very enlarged. They are usually not encapsulated. When I see it on the ultrasound, these nodules are not encapsulated. So we really don't know, are they with increased vascularization, you have increased also a neurological component to it, and then it becomes angiolipoma and so on. But do we know exactly what causes the pain? I am not quite sure if we have specific component of the pain component to the lipedema, but the distribution is usually around, the painful part is around the medial aspect of the knee and down to the ankles. And as Patty pointed out, in more advanced cases, it becomes lipolymphedema. And then you can have stagnation of the lymphatic system with maybe microaneurysm of the lymph vessels, leading contribution to the subcutaneous space, giving rise to lipolymphedema. And before I go any further, I do want to point out, even today in 2024, I see periodically patients with lipedema of different stages where they were sent for diagnostic evaluation, and the first thing was the treatment with diuretics. And diuretic is not really a drug of choice for lipedema. And I cannot forget about one patient who was on 200 milligrams of Lasix. 20 milligrams per day didn't work, so the doctor said double the dose, and it escalated. Lasix or furosemide is not going to reduce the adipose tissue distribution or enlargement in subcutaneous tissue. So please don't.
That is an effective prescription for putting somebody into renal failure, though. I can tell you.
Congratulations. Yes, renal failure, here I come.
I can tell you that. So, Patty, jump in. Anything that you want to add to that conversation as a patient and as somebody with significant experience and knowledge?
Vein Formula 1000 and Lymphatic Formula 1000 from VitaSupport MD are backed by science and sold in doctor's offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Recently, I've been doing a lot of research and education for fascia. Once we learned it was a loose connective tissue, I kind of went down the path of that. And there is a lot of nerve endings within the fascia, and they're learning more and more about that as well. And so my thought is primarily it may be in that regard, and that may be a good place to start some of that research that's needed.
Yeah, it's interesting because the reason I asked the question is because we know clinically, I see that each and every day, but I was not aware. I know Dr. Eicher has a mastery of the literature. If anybody had done any histological studies looking under the microscope to see if there was an increased number of nerve endings or hypertrophy of the nerve ending fibers and so on, because I was not personally aware. But I think it's an interesting subject that needs further evaluation. And certainly those patients with those inner knee lobules and the ankle lobules and so forth that I see, they'll often point to those areas as areas of increased pain and tenderness. And sometimes I wonder if that's just a stretch phenomenon, the tension on the skin and the soft tissues. But I think we're all in agreement. It's somewhat of a ongoing area of research that we don't know all the answers to.
Yeah, I'll say as a patient and somebody who has a lot of nodules, I've had an ultrasound before and I was on the ceiling because it was so incredibly painful, and just tears, like that level of pain, just pressing the nodules hurt. It's not even about putting your weight on your knees and kneeling, which I'm sure exasperates that as well. But just in touching and squeezing in certain areas, not everybody has that level of pain, but many, many do. I mean, it was initially called the painful fat syndrome.
That's right. And I know that a couple of the episodes of the LymphCast podcast from your email that you enjoyed most were those with Catherine Sale and also with Linda Ann Kahn. And those seem to have been fan favorites, I think, on YouTube, which is our least watched. Most people listen to them as podcasts, but on YouTube, I think they both have thousands of views now. So Linda Ann and Catherine continue to be very popular leaders in this area. And I know that Linda has had interest in fascia, and Dr. Iker just mentioned it. Emily, what is your take on this new and very robust interest in the role that fascia may play in these disorders?
I think this was neglected, or just like lipedema, we didn't know 20 years ago, we didn't know much about lipedema. Today we are much more knowledgeable, but we are still focusing on a subcutaneous space and enlargement of the nodules. But I think now we have to shift the research towards the fascia. And I do ultrasound on the first consultation. I always combine the clinical presentation with ultrasound finding, ultrasound of subcutaneous tissue. I don't do venous studies or vascular studies, but it is interesting to see the difference and the variety of subcutaneous changes when we have lipedema, whether it's lipedema stage 1, 2, 3, or more advanced. But pretty much all lipedema patients have inflamed subcutaneous fascia, and whether it is just a superficial fascia or deep fascia. And I think And so when I do the ultrasound, I want to see, is there any vascularization there? And clearly it shows me that there is innervation and vascularization to fascia. So I think we now have to shift research towards the anatomy and behavioral changes in fascia in lipedema.
Interesting. Now, one other area that I want to touch on, I want to get into actually, when we talk about exercise with Patty Cornuto, not only is she involved personally and working with her husband and their group, but my understanding is that some years ago, Patty was looking for a 5K that might have existed for people with lipedema, couldn't find one, created her own 5K, which is the perfect solution to a problem. When you don't see an answer, create the answer. And then, to my amazement, and you have to tell us about this, Patty, my understanding is that this 5K has now morphed into an actual triathlon for people with lipedema.
Yeah, it actually morphed into a triathlon within months. So the very first event was a triathlon. Wow. And I made that leap because when I put out for the 5K, like I had done the Learn 5K for lymphedema the year before. And so that's what kind of enlightened me. I'm like, oh, I want to do this. And I was able to do it virtually. So I'm like, well, why can't we make one for lipedema? We'll just make one. And one of my training mates is an Ironman. And I said, you know, there's a lot of people who use the pool as part of their way of moving with this condition. So if I want to have the most people I can participate if they want to, I want to include the pool. So that just makes me think about a triathlon. And she was all in, and we do a sprint distance. So the shorter distance, which is a 750 meter swim, followed by a 20K bike and a 5K run walk. And we like to say it's all or something. So you can participate in just the swim or the bike or the run, or you can get a group of friends to do it all together, or you can do the whole thing like we do all at once. And this year is June 29th is the next one.
Oh, great. And that's number 9 from what I understand.
Number 9. Yeah. Getting ready for 10 next year. We're very excited.
That's
and
amazing.
Where does it take place?
I do it locally in my hometown. The YMCA here hosts us, and it's a virtual event. So everybody can do it from their own location. And this year we have people from Africa, Australia.
Fantastic.
Yep. And I have one woman who is doing it in 3 separate locations. And one of them was Japan. And I think Alaska was the other one. And she said the third one is going to be a surprise. She's not sure where the trip she's on is going to lead her. But people break it up. So I have people that, you know, have to sit on the couch and use a seated elliptical machine like a QB. And so they'll start at the beginning of the month and, you know, build up to the distance that they want to participate in. So it's absolutely incredible. And we have people like Juzo and Brenda Viola this year both sponsored us. And we got some great merchandise. We have t-shirts and some water bottles. And yeah, it's just a very fun event. And it's a nice way to spread awareness about lipedema, but also the importance of staying active.
That's fantastic. I know that Dr. Iker, and you can speak on that, Dr. Eicher, has long been a huge proponent of the swimming pool for people with lymphedema and lipedema, correct?
We are so blessed, especially in California. We have a lot of YMCAs or sports centers or private pools. And so whenever possible, I recommend swimming or aquatic therapy for these patients. And they do not only feel better after training, but they show the results. And I just wanted to point out that, again, it is progressive, annoying disease, but it doesn't have to be progressive. A dear friend of mine, I didn't even know she had lipedema. She has a wellness center, and all her life she's in exercise and fitness programs. Now, when I examined her and I did ultrasound, it was clear-cut lipedema, stage 1, and she's at the age of 60 plus. And so you may maintain stage 1 till rest of your days. Perhaps there was a minuscule change with the hormonal influence of menopause, and so where the tissue consistency or subcutaneous tissue is a little bit softer, but not much expansion in terms of volume. So we did not have to see from stage 1 jumping to stage 3. You can maintain stage 1 if you work on this. And yes, it is persistent, diligent workout along with the nutrition aspect, compression garments. It takes everything. One component would not be sufficient to maintain stage 1 for prolonged period of time. But if a patient is compliant, you may continue with the stage 1 and not to experience these dreadful changes of stage 3 with lobes and very heavy lower extremities. Again, resting and keeping legs elevated is not the treatment of choice.
No, I remember in our group, our private group, when people try to join, we ask questions and make sure that there are patients and how they heard about us. And I remember when I started getting people saying, my doctor recommended you to me. And I was just like, wow, we came full circle to, being told not to do this, to having doctors recommend our group for these patients. And that was a huge win.
I think you should advertise more so the lipedema patients know where you are. And this is fantastic that you are doing virtual, because patients don't have to come to you, but they get to you via virtual technology, and they can participate from their home.
Yep.
Well, let's take advantage of that opportunity now. I know we'll do it again at the end of the show, but sometimes listeners don't hang around till the end. So before we forget, Patty, why don't you share with our listeners all the places that they can follow you, contact you, all the opportunities that you present, and so forth?
Lipedema Fitness is the name on every social platform. So I'm on LinkedIn, I'm on Instagram. I even have a very early beginning on TikTok. And we have a private group for patients only on Facebook. And we also have a public page on Facebook as well for doctors and medical professionals and family members who may be interested. There's a website you can go to, lipedemafitness.com, that has links to all of those. It has links to sign up for the triathlon if you would like to do that with us. And every month I'm part of the panel for the LymphaPress Lipedema Patient Roundtable. And that's a fantastic event if you are a patient or a medical professional. It's a once a month, the third Wednesday of every month at 8 p.m. Eastern time. We have a panel of 5 patients, and we usually have medical professionals on as guests. And we have a huge chat of people who are live with us, but only like in the chat area, that are talking and answering questions and supporting each other. And it's just a wonderful evening. We call it the best night of the month.
Yeah, that does sound terrific. And also tell us, are you still doing the Living with Stage 3 Lipedema live series on Instagram?
Yep. My friend Crystal, she's from CFIT Revolution. She and I started that group going live because we were going through menopause at the same time. And we were finding that the things that we were doing, we're both very fitness involved. And that's how we slowed our progression. We're both stage 3, and we would be behind the scenes kind of talking about the things we were doing were no longer working. And so then we were like investigating surgery or, other avenues of things that we would be interested in. And I said, I bet you there are a lot of other people who would really benefit from these candid discussions. And so we started doing that. And I think the next one is June 23rd, Sunday at 2.
Wonderful, wonderful. These are great ideas. It's something that we've been toying around with since our inception a couple of years back, about doing some live programs and having live interaction. I think that's wonderful. Let me ask you this, Patty, with all of your experience and working with all of these people, do you have any particular stories about patients that stand out? For example, when we talk about preventing progression, this is an enormously important subject and an enormously important goal, I think, that for patients to have. But have you seen, or Dr. Eicher, have either of you seen any patients with dramatic reversal of their lipedema through diet and exercise and movement, et cetera?
If you're like going from a stage 3 down, really does seem to involve either, I know a lot of people did really well when the keto diet first kind of hit the scene, and many people were able to lose, their regular fat. They weren't able to lose their lipedema fat, but they got a much better quality of life. Surgery is a big component of that. I've seen people reverse stages through, removal of the lipedema tissue. That's really the only way we've seen to get it to be removed, but it's not a cure, but it definitely helps to reset where they're at. I have not seen people definitely progressing, just like Dr. Eicher is saying, it's not a given. You really do have to be, and we're all so unique in what responds and what works and how we show up with our conditions. So that is my experience.
Emily, how about you? Have you seen any reversal without surgery, or is in your experience, the lipedemic tissue just so recalcitrant that it really does not respond like normal adipose tissue?
Well, dramatic reversal, I have not seen. If someone is stage 3, it's very difficult to go back to stage 2 to stage 1. Clinically, I have not seen that. I've seen an improvement in the pain reduction, improvement in subcutaneous tissue reduction, but it's not on a large caliber in terms of volume reduction once you are stage 3. Gradually, you can improve, but gradually you can achieve improvement in pain. And pain, it was demonstrated and published by Dr. Herbst and Amato that liposuction does reverses the pain or improve pain significantly. I come to think of me, I had one patient and she was just a stage 1. However, her pain was so enormous. She was a 10 out of 10 in terms of pain. And what was said is, she said, when the husband tries to embrace me, I cringe because it hurts so much. With liposuction, and this is lymph-sparing liposuction, which is not a cosmetic surgery. It has to be done by well-qualified a surgeon who is well-versed in lipedema. The pain level improves. Also, what improves is the outermost shape of the adipose tissue. But again, if you are stage 2 and you have certain contouring with liposuction, it may improve, but it doesn't reverse lipedema to stage 0. It may improve, but not drastically to improve to stage 0.
This has also been my exact experience. But I think it's always important to get different viewpoints and different experiences, and it sounds like we're all on the same page with that. Now, another question I think is very interesting, which we have not discussed up until this point, as far as I know, Emily, and you'll correct me if I'm wrong, but I'd love Patty's input, what she's hearing in the world of social media and through her connections, and what you're seeing in the office with this sort of craze right now for the use of Ozempic for weight loss. Are you seeing that in the lipedema community as something that people are interested in, asking about, or are there physicians treating lipedema patients with Ozempic? Any feedback on that?
I have some patients on Ozempic, lipedema, as well as lymphedema or lymphedema patients. There is some improvement. However, one has to be very careful that it does not interfere with other medical problems. When the patient is only lipedema patients or only lymphedema patients, one has to be supervised, medically supervised when taking Ozempic, not to be over eagerly taking Ozempic to drastically reduce the weight. I've seen few patients, they reduced maybe 20 pounds, but still they have the lipedema. And that applies also to lymphedema. I have one patient who is lymphedema, started with lipedema, then she had gynecological surgery and it triggered lymphatic problems. So she has lymphedema in one leg. She improved last 20 pounds on Ozempic and her mobility is much better. Still, she has the pain and discomfort, but not to the extent that she had before. But now she's slowing down with the Ozempic. So
are you seeing an uptick in patients asking you, Emily, about it or for it?
consulting, yes. Requesting, not so much. I would love to see the patients doing more conservatively approach, to do manual lymph drainage, to do compression pump treatment and nutrition first before they would reach out for any kind of a medicine to reduce the weight.
Patty,
I've
what
seen
are you-
patients, sorry,
sorry.
I've seen patients who had bariatric surgeries and overall the response is temporary. They may reduce the weight initially. However, usually they reduce the weight waist up and not waist down. So the adipose tissue is with very minimal change. And then a year later, they may bounce back and gain the weight back.
Right.
So it's very, one has to be very compliant once you are diagnosed with lipedema and follow the guidelines, just as Patty pointed out. And it's not just a diet, it's not just exercise, it's a combination of factors. It's to be supervised by hopefully well-trained therapist or a physician, do the manual conservative therapy, compression garments, compression pumps, compression exercise program, breathing exercises. I send patients also for allergy testing to see the sensitivity to certain foods and eliminate those. And if they have any GI symptoms, they should be followed by a GI physician or nutritionist, because that is great component to lipedema as well, and so on. But the compliance is the most essential part.
Now, how about you, Patty? What are you hearing? Because one of the things that, of course, I see in my practice is the Ozempic is so, I don't write for it, but I have had patients ask me and I refer them back to their primary care doctors. I do tell them that I don't think it's appropriate for patients with lipedema. But what, of course, is so compelling for patients is it's a pill, and people love to, take something and hope for a sort of miraculous response. So what are you hearing out there?
Well, I have done a ton of research on these medications. I had somebody in my group ask a question after a presentation once, and I really wasn't on my radar at all. I've never been somebody to take medication for weight loss or anything like that. But I happened to start doing my research, and I found there was a lipedema group that was with these medications, and there were thousands of people in there, and it was a very active group. And I asked to join, and I just kind of stayed behind the scenes and was reading through the post and reading through the comments, and I'm hearing these, results of a lot of inflammation reduction. And after, one or two doses of the medication, I would go from, having incredible pain when I would stand up first thing in the morning to not having any pain in the morning, and just things of that nature. Not everybody was having that response, obviously, but it piqued my interest, and I started to do more research on it, look into the anti-inflammatory and anti-fibrotic properties of these medications, because they're replicating a hormone that we produce naturally. And so I wanted to understand more about that. And I happened to start writing a few posts about it, and we introduced it on the roundtable. And I was really surprised to find that many of the people that are friends, they are my dear friends in the community, had been taking these medications for years. So I began.
Forgive me, just may clarify for our listeners. I think I may have said it's a pill, but it's generally a weekly injection. I don't know if similar drugs might be in an oral form, but the Ozempic, I believe, is a weekly injection, if I'm not mistaken.
Correct. And Ozempic is actually for diabetes. Wegovy is the version that's for obesity. And now there is Zepbound is Mounjaro's version for obesity as well. So Zepbound or Wegovy are the two specifically for obesity. And quite honestly, I just took a fourth injection last Sunday. So I have just begun the series with Wegovy, and I noticed immediate inflammation reduction. I have a picture of myself at the FDRS conference of my face, and I have a picture that was just after a Peloton ride I took last Friday, and I was blown away at the reduction in my face of inflammation. So I am just basically experimenting on myself at this point right now. I don't, advocate for anybody else to have that experience, but it's something that I've done a couple of years of research on, and I am very curious as to the anti-inflammatory and antifibrotic components of the medication.
Interesting. Emily, you walked away for a moment, but Patty shared with us that she started the Wegovy. She just took her fourth injection. So you've been on it 1 month. Is that correct?
Correct.
And she feels that she saw a very, this is not medical advice that we're giving here. This is not science. This is just Patty's testimonial about her own personal experience. She's stating that she feels that she noticed an immediate decrease in inflammation. Is that, I don't want to misquote you, Patty.
Yep, that's exactly correct. And the thing that people need to realize is when you begin these medications, the initial doses are not in a weight loss capacity. They are just a very minimal dose to introduce the medication to your body. So it's even more surprising that I've had that reaction. Like I document everything when I do research, and every little thing that I noticed, I documented it. And after week 1, I had this. After week 2, it was this. I had a patch of inflammation that had began after menopause on the back of my head that was probably the size of my palm. And it was very alarming to me. I had not ever experienced that before. And I had a lot of inflammation in my jawline. And the first couple of weeks, the jawline seemed to ease up. And then I happened to go do my treatments that I do for the back of my head, and it was flat. And that's something that needs investigating. That's something that needs research. I don't understand how it happens in that of a result, but I'm here to learn from the experience that I'm having.
Interesting. Well, I think one of the things we know is that obesity is a risk factor, certainly for increased risk of type 2 diabetes. I wonder if Emily or Patty, if either of you know specifically from FDRS and other meetings that you've attended, is there any correlation between lipedema and increased risk of type 2 diabetes?
We don't typically have diabetes.
Yeah, that has been my experience also.
Yeah. Which
is surprising in some ways, but then again, it's not, because it's not typical obesity, and it is a soft tissue disorder, and is a creature all its own. Emily, your experience there?
Right.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
Loose connective tissue disease. And when you see one reason why I don't do virtual examination is because I have to put the hands on the patient. And usually lipedema patients have this very soft, fluffy tissue consistency, and which you don't see that in controls. However, it would be interesting to do study on a control group, Ozempic group, and also a group lipedema patients of the same, maybe stage 1 or stage 2 or even stage 3 in different categories, and compare them to anti-inflammatory supplements. And
Yes.
what would be the response to be on persistent, maybe 1 month anti-inflammatory supplement as opposed to Ozempic group? I don't think that we have enough study on Ozempic and long-term effects and Ozempic and lipedema patients only. And I think that it really asks for a further study, research, and so on. But I've seen a nice results when we are using bioflavonoid supplements. It's not as drastic, but the inflammation is reducing. And I see that also on the ultrasound study when we do the ultrasound study.
Yeah, interesting. I have another, as we're getting, unfortunately, the time always goes so fast. And Patty's such a terrific guest. We're going to have her back. You have an open invitation, Patty. We have so much to talk about. But because I know you are such a serious student of this disease process and a key opinion leader, a thought leader, and a leader in general for so many years, we've touched on it. What is the research you've done personally about surgical intervention with liposuction? And it sounds like to date you have elected not to go that route. So give us your thoughts and feelings about that. It's something, I don't perform that kind of surgery, but it is something that I'm very much interested in, not in getting involved in it personally again, but I do feel that maybe it's an underutilized modality for patients with lipedema.
I do not think it's underutilized. I think many people use the surgical route because it's the only thing that can remove the tissue. It doesn't take it, you don't stop producing it. It doesn't cure your disease, but it's the only thing that can literally take it out of your body. So we have a number of people in my group who come to do fitness pre-surgery, post-surgery. There's many people that I am friends with who have gone through that experience as well. And I am not against surgery at all. It is definitely something that I never thought I would do. I thought I would just be happy with my fitness, and I was always able to move my body the way I wanted to. So that really for me was okay for me. I didn't mind the way my body looked as long as it functioned the way I wanted it to. But since going through menopause, my symptoms have definitely shifted. And the things that, like I said before, I had been doing and being in that position of being able to move my body in the way I wanted to were no longer working. And walking has become a challenge for me since menopause. I have, switched to riding a bike versus walking because I can ride my bike with less, difficulty than I can with walking. So that's part of the reason I was willing to go down this route of the medication. And it's also part of the reason Crystal and I are having those conversations about, would we consider surgery? And we are both at that point where we would consider surgery. It's a big deal though. Surgery is a big deal. And I think you really have to find the right surgeon for you. And I love at FDRS when I get a chance to hear from each of the surgeons and what their methods are, because it's really personal. So if I am a stage 3 and I have lymphedema as a secondary component, I may not be able to work with every surgeon. So I really need to find the surgeon that has the experience at my stage, where somebody in a stage 1 may be able to work with many surgeons. And then it's really about, who do you mesh with and who, that's a big part of it too, I think, is the connection with the surgeon. And I know like my friend Kara, who had surgery 7 or 8 times to get to where she was finished with her surgeries, had an amazing relationship with her surgeon, you know, and that went a long way because she's somebody who was like me, and I could see her and go through her journey with her. And when I saw that, I realized that was definitely something that was open to me. I didn't necessarily know that it would be open to me at my stage, but by seeing her journey, that really said, this is something that I can do, and I would just need to find.
One more question before we sign off, because I know Dr. Eicher has to go and we're all on a timeline here. You said something which I find interesting, and I'm sure our patients want to know what you mean by it and what your perception or perspective of that is when you say surgery is a really big deal. I mean, you've seen a lot of patients, you have a lot of friends, it seems, who've had the surgery. A really big deal in what way, in your opinion?
It's surgery. It is cutting into your body. It is potential to make things worse. There are people who have, you know, experienced not a great result with their surgeon and not a great experience with what was done to them, didn't heal. We don't know how we're going to heal. A lot of people have wound issues and things that they have to, you know, get through. So it's just, some people see that people are going and having surgery and everything's great and they feel great, and they kind of maybe jump into that. I just think you really need to realize it's surgery. It's still surgery.
I agree.
And
I agree with you 100%. And I was raised in the mentality, and I know my dear friend and colleague Peter Gloviczki, who's been on this show, and Monika is his wife, who's an esteemed colleague and expert. Peter is famous for saying there are no small operations. Every operation, removal of a skin tag, a skin mole, has potential hazards. And so I think that I'm not discouraging surgery, certainly as a surgeon, but I wanted to get your perspective on that because I think it is important for people to know that it is invasive and it does come with risks, and not every case is going to be perfect, and there are a mixture of results. And I think finally, Emily, I'll pass it right back to you to finish, because I know you have a lot of experience and strong feelings about surgery, and then we'll wrap it up.
Well, just like every patient is different, whether you are stage 3 or stage 2, every stage 1, stage 2, and stage 3 patient is different. Surgery, yes, it is invasive, but not drastically invasive. And if you are compliant, you have the right expectation, you should be able to heal well and do well. Most of the patients that I've seen post-surgically, if they adhere to the prescribed protocol, they tend to do well. They may not, but again, you have to have the right idea and perspective. If you are stage 3, you are never going to end up with the legs of Cindy Crawford. Okay, and if you have that set of mind, it's not going to work for you. Most of the surgeons in our location are fantastic, and I have not seen many complications, and patients overall improve in quality of life and mobility, and that is the key. And then you can do more, then you can be more active. But if you go in a stage 3 and you think that you are going to end up with very skinny legs after one surgery, it's not going to work that way.
Agreed.
yeah, it's not cosmetic.
It is absolutely not cosmetic.
And I think one of the keys here in listening to Patty is that the patient has to feel prepared mentally, emotionally, physically, that it's the right time for them and it's something to pursue and get an expert opinion. And I've said many, many times, if you have any doubts about your surgeon, your doctor, etc., your therapist, whomever it is who's working with you in your problems, your athletic trainer, get a number of opinions. Get a number of opinions until you feel comfortable. You don't have to rush into these decisions. You do have, fortunately, in this disease process, which is chronic and somewhat progressive, it's not an emergency, and you do have the luxury of time to take your time and make those important decisions. Well, with that, I have to say, I think we've had a tremendous discussion. It's been my great pleasure to meet Patty personally for the first time. I'm sure we're going to get to know each other a lot better after this and continue to
I
be in
hope so.
close touch. And Paul, I'll give it back to you to sign us out and say our goodbyes. Unfortunately.
All right. That's right. Patty, before we go around the room and thank everybody and give out information on the show, can you put your information out there one more time? Website, social media, whatever you want people to know.
Sure. Lipedema Fitness is where you can find me pretty much everywhere on social media. Lipedemafitness.com will get you to my website that has links to all of the other locations.
All right. Perfect. Thank you very much. And to everybody out there, this has been LymphCast, episode 55. We thank you for tuning in. Again, hit up the website. Do it often. There's always new information going on there. And that is lymphcastnetwork.com. And Dr. Chuback, would you have the honors of thanking our special guest tonight?
Yes, I will. And also remember to look for us in social media on LinkedIn and Instagram. Patty, once again, it has been a pleasure to get to meet you personally. Your reputation certainly preceded you as someone who's passionate and has great expertise in this area of lipedema. I know that you're highly respected by clinicians like myself and Dr. Iker, as well as the lipedema community out there. Keep up the excellent work. Keep up your studying. Keep up your personal research. Keep up your championing of this cause, because it's important. I'm so impressed with the work you've done. And I look forward to building a stronger relationship in the future and watching what you go, where you go with it, and learning more about your personal experiences with your own healthcare. Thank you so much.
Thank you so much. This has really been an honor.
All right. Terrific job, Patty. Thank you. From California, Dr. Emily Eicher. Dr. Eicher, thank you for everything tonight.
Thank you. Thank you, wonderful team. And thank you, Patty. And congratulations on your fabulous work.
All right, very good. The founder, owner of Vita Support MD. They make Vein Formula 1000 and Lymphatic Formula 1000. He's also the gentleman who started this show from New Jersey, physician, surgeon, Dr. John A. Chuback. Thank you, Dr. Chuback, for everything.
Thanks, Paul. It was great. Really great.
You bet. And again, this has been your LymphCast show, episode 55. Have a great night. We'll see you next time for episode 56 of LymphCast. Have a great night.